Good afternoon. Good afternoon, Senate Finance, and to our few guests. Today is Monday, April 3rd, 2023. You should have in front of you voting list number 26 on yellow paper. We have many bills to go through today, and so we're going to get through as many as we can. Some of us have a hard stop at 3:50 as we have executive noms this evening, and many of us that serve on that committee want to be on time. 6 of us are on executive noms, so we'll just trust you. Yeah, so we're gonna have a hard stop at 3:50 so we can get upstairs and be on time. We're gonna start with Patrick. Good afternoon, Patrick.
Good afternoon. So at the start from the top of the list here, we have House Bill 587, which is a local liquor bill from Baltimore City. This bill is similar to Senate Bill 765, which the Senate passed earlier this session. The bill authorizes the Baltimore City Board of License Commissioners to exchange a Class B D7 beer, wine, and liquor license for a premises located on a certain section of Frederick Avenue for a Class A7 beer, wine, and liquor license. The House struck some existing statutory language indicating that these provisions of law governing these A7 licenses do not apply in the 43rd Legislative District. I think they were fixing something with the existing statute that needed to be addressed. The House also struck a prohibition on the board to issue a Class A7 license on or after a certain date. The Senate added a floor amendment that addressed some requirements for a beer, wine, and liquor license for an establishment within the Cross Keys Marketplace. So an amendment would be needed to the House bill to align the bill with the Senate bill with that amendment. And then the bills would be in the same posture. And I have a letter from the City Senate delegation in support of the House bill here with that amendment.
Thank you. So are there any questions on House Bill 587 or confirming it to the posture of the Senate bill? I have a motion and a second for a favorable on House Bill 587 as amended into the posture of the Senate bill. All those in favor, raise your hand. That bill receives a unanimous favorable with amendments. Next bill.
House Bill, House Bill 884. This is a bill that authorizes but does not require Baltimore City to honor certificates of guarantee issued by a nonprofit association of contractors or its wholly owned subsidiary in order to satisfy certain city bond requirements. The City Senate delegation met and approved this House bill without any amendments.
Second. Have a motion and a second for a favorable on House Bill 884. I don't see any questions. So all those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
House Bill 885, also a Baltimore City alcoholic beverages bill. This is similar to Senate Bill 589, which the Senate passed earlier this session. Among other changes, the bill extends the sunset for certain provisions associated with a related event promoters permit issued by the Baltimore City Board of License Commissioners. This related event promoters permit was established to provide for events related to the Central Intercollegiate Athletic Association basketball tournament. The House made a technical change to the bill, and the Senate had moved up the sunset date of the bill. But as I understand it, the city delegation voted to approve the House bill clean without any amendments.
Have a motion and a favorable for House Bill 885 without amendment. Are there any questions? All those in favor, raise your hand. That bill receives a unanimous favorable report. You're done, Patrick? Thank you. We'll go to David.
Okay, first bill or the fourth bill on your list is House Bill 246. It's similar to Senate Bill 322, which passed the Senate. unanimously. The bill authorizes the holder of a Class 4 limited winery license to prepare, sell, or serve food other than previously permissible listed items if the license holder is also licensed to operate a food establishment and obtains a class, as the bill, as it came across, obtains a Class B beer and wine license. There is a difference between the House bill and the Senate bill. The House bill has that requirement to obtain also a Class B beer and wine license subject to the local licensing authority. You have a reprint in front of you with amendments offered by Senator Beidle, who is the sponsor of the Senate bill. And if you go to page 4, it strikes that requirement that they also have a Class B beer and wine license and goes back to the bill as introduced. Meets the same ratio of gross receipts between food and alcoholic beverage sales as a holder of a Class D beer and wine license.
Okay, Senator Beidle.
Thank you, Madam Chair. There are some other amendments too that we're going to take from the House concerning the food preparation, expanding what can be prepared, but
Yes.
this is the only difference is the counties were not sure about how to issue that, and we're taking that out. Thank you.
Thank you very much. Are there any questions, Senator Kramer?
Did you just say there's more amendments coming?
It's in the reprint.
Oh, okay, thank you.
Hey, Senator Lamb.
Thank you, Madam Chair. I had a question because I did get a call from the Maryland Association of County Health Officers, and they were concerned about the amendments that the House made in sending it over. And I guess my question is to the sponsor, do you know if this addresses all of their concerns then, or?
There was a subsequent email from the health department that said that they're okay with the language. They're going to convene a work group to study this issue with the local health officers. So there's no amendments needed on this bill regarding their concerns.
And this came in after Friday?
Yes.
Okay. And it addresses any issues with prepackaged or light fare kind of food?
They're going to have a work group to study this matter, and it doesn't need to be amended onto this bill that they're going to do this one way or another that they said in their email.
Okay. All right. Thank you.
Hey, any additional questions for the sponsor or staff on the amendments or House bill? Have a motion and a second for a favorable on the reprint of House Bill 246 that we have before us. Any questions? All those in favor, raise your hand. This bill receives a unanimous favorable report. Next bill.
Okay, the next bill actually should have probably been on a consent calendar a week or two ago. This is House Bill 669. It deals with an alternate route to becoming a licensed real estate appraiser or certificate, or to get a certificate as a real estate appraiser. The bill is identical to House Bill 455, which unanimously passed the Senate. And again, it just provides an alternate way by using this particular course to get to become a licensed real estate appraiser or certification as a appraiser in lieu of hours spent under a currently licensed or certificated appraiser.
Motion and second for a favorable on House Bill 669. Seeing no questions, all those in favor, raise your hand. So that bill receives a unanimous favorable report. Next bill.
Okay, the next bill is House Bill 784. This is a local Prince George's County bill, alcohol bill. It establishes a framework for inspections of licensed premises performed by or on behalf of the Prince George's County Board of Licensed Commissioners. The bill also establishes a work group to study best practices for safe event promotion in Prince George's County. It also requires the board to establish a standard fine structure for violations of alcoholic beverage laws and clarifies that a Class B beer, wine, and liquor license holder may serve beer, wine, and liquor by the glass or by the bottle for on-premises consumption. There are two amendments. You have a reprint in front of you offered by the Prince George's County Senators. They're technical and alter the title, also allow various Class C licenses to also serve beer, wine, and liquor by the glass or bottle, alters the inspection requirements, increases the time for a license holder to receive an inspection report, and alters the membership, chair, staffing, and scope of the established work group. The bill has a letter in support by the Prince George's County Senate delegation.
Any questions? I have a motion.
Second.
Have a motion and a second for a favorable on House Bill 784 with the delegation and other amendments. Any questions? All those in favor, raise your hand. That bill receives a unanimous report.
Okay, the next bill is House Bill. Hold on, it's got my out of order here. The next bill is House Bill 863. It, except for homicides, extends the time period within which a person in interest may request that the chief medical examiner correct findings and conclusions on the manner and cause of death from within 60 days to 180 days after the medical examiner files those findings and conclusions.
Yes, Senator Reedy?
I'm sorry that I think I missed the hearing because of all this time of the year. So it's gonna extend to 180 days. What does this do to people who are waiting to finalize everything doing with a passing of a relative?
You have to, it has to be on the request of a person in interest. So somebody would have to actually request that this extension occur, and the testimony or provided by the sponsor was sponsor only because there was no opposition, had to deal with cases of possible suicide.
Okay, so this is to allow somebody to request it. It won't be a I'm just making sure I understand it. Because somebody raised that question to me, but I don't think they understood the bill, and I obviously didn't look close enough at it either. So it's just, this bill just allows them to extend it at the request of the family,
Of a
or
person of interest, whoever that is under the general provisions article.
so it could be family or
Yeah.
also, gotcha. Okay, and obviously murder, as you led off with.
Except for.
I got everybody's attention. They know. Okay,
Yeah.
great. Thank you.
Thank you. Any additional questions on House Bill 863? Seeing none, I'll entertain a motion.
Move favorable. Second.
Have a motion and a second for a favorable on House Bill 863. Seeing no questions, all those in favor, raise your hand. I think that's a unanimous favorable report. Next bill.
Okay, next bill was on a voting list last week, and it should have been on a consent calendar. However, at the last second, we got a word from the Attorney General that there might be something unconstitutional in the study requirement. So House Bill 909 is the same, and it is in the same posture as Senate Bill 827, and Economic Matters will also be amending the bill similarly as you have in front of you. It extends the termination date for the State Commission on Real Estate Appraisers, appraisal management companies, and home inspectors until July 1st, 2026, and requires an independent valuation of the commission. You have a reprint. If you go to page 2 of the reprint, you'll see that the process for the study has been amended to take out the unconstitutional part, which is basically requiring a General Assembly entity to oversee an evaluation conducted by the executive branch. And Senator Hayes is the sponsor of the crossfire.
Have a motion and a second for a favorable on the reprint of House Bill 784. Seeing no questions, all those in favor, raise your hand. Yes, did I read? I'm sorry, I read the wrong bill number.
909.
909. Very different bill. We already passed. Okay, all those in favor of House Bill 909 as is presented before you, raise your hand. That bill receives a unanimous favorable report with the amendments. Thank you. Next bill.
House Bill 977 is a reorganization bill that establishes the office of the Chief Medical Examiner as a unit within the Maryland Department of Health rather than in a state postmortem examiners commission. It moves all the staff, all the other functions related to the to this office into the department rather than under the commission. The bill redesignates the state postmortem examiners commission to be the postmortem examiners advisory committee, which must advise the Secretary of Health and the office on the implementation of the laws and activities related to the offices of the chief medical examiner. And there's also changes in the bill relating to the pension of these folks. Most of this bill, in fact, almost all of this bill is related to the fact that you're just moving this office from the commission into the department. No amendment.
No negative, no unfavorable.
No unfavorable.
Did you have a question? No. All right, we have before us House Bill 1146. I don't see any questions. I'll entertain a motion.
Favorable.
Have a motion and a second for a favorable on House Bill 1146. Were there amendments?
No.
I'm
amendments.
sorry, I keep looking ahead and looking across the, yes. I'm gonna go back on the list. I already crossed that one out. That's my problem. Okay. House Bill 977, which is the Maryland Department of Health Office of the Chief Medical Examiner bill, is before us. And I have a motion and a second on the favorable. Senator Ellis.
Thank you, Madam Chair. Is there a background? I think I was at a hearing when this bill was proposed. Is there a reason, a background for the movement? Is it?
Over the years, if you've been following media accounts, there's been several problems with the office, and there's been delays, there's been problems with data. So I think this may actually be a departmental bill that was brought in through the chair over there. And so what you're doing is you're taking out of this commission, turning this commission into advisory, and then putting them in a department where they're directly overseen by the secretary.
Okay, great. Thank you. Thank you, Dave. Thank you, Madam Chair.
Thank you. We have a motion and a second for a favorable. Seeing no further questions on House Bill 977. All those in favor, raise your hand. Seeing no opposition, that bill receives a favorable report. We will now turn to House Bill 1146.
1146 is 1146 House Bill is a study bill. Very much amended by the House the House of Delegates. It requires that the Maryland Department of Health in consultation with the Maryland Hospital Association to conduct a survey of hospitals to identify the availability of hospital operating room resources for dentists. Part of the things they're supposed to look at are the number of dentists credentialed at each hospital, the number of operating room minutes available for these dentists, the percentage of available operating room minutes used by these dentists over a preceding period. The next part of this study requirement is that the Maryland Department of Health, the Maryland Healthcare Commission, and the MHA shall conduct a regional needs assessment and regarding dental procedures that require anesthesia or moderate sedation that will look at, again, the survey on capacity that's conducted under the previous section, available information that can be used to assess capacity for dental procedures in ambulatory surgery centers, estimated startup and operating expenses for configuring and operating an operating room for dental procedures. This would be at an ambulatory care facility. And the availability of ambulatory surgery centers to pay stipends to anesthesiologists related to these procedures. They have to develop regional plans to ensure the availability of these operating room space for performance of dental procedures. That's the whole purpose of this, is to make sure there's adequate operating space for dental procedures in Maryland hospitals and ambulatory care facilities.
Hey, are there any questions? Vice Chair?
Are pediatrics and that's rolled into that too?
This is just dental. This is dental surgery.
No, dental pediatric surgery.
I don't think it's specified, so I would
Okay,
imagine.
but they are making, it's to look for more room in ORs.
Yes.
Okay, thank you.
Hey, any other questions on the bill? Seeing none, I'll
Favorable.
have a motion and a second for a favorable now on House Bill 1146. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report. Next, is that it for David for now? All right. Hey, Nathan.
Hi, Madam Chair. The next bill on the list is House Bill 26, which establishes a second pathway for licensure as a psychologist from the State Board of Examiners of Psychologists. The bill, as you may recall from testimony, is for individuals with a non-clinical PhD to eventually become eligible to practice as a licensed psychologist. So to qualify, an individual must have a doctoral degree from in psychology from a school or university that at the time the degree was awarded had a certain accreditation. The individual must have received must have received postdoctoral re-specialization certification from a Department of Psychology that at the time the certificate was issued had a degree program accredited by the American Psychological Association or the Canadian Psychological Association, and that the degree program included a minimum of 1,750 hours in a supervised internship in accordance with board regulations. And then finally, that the individual have completed at least 1,500 hours of training as specified. There are no amendments, there is no fiscal impact, and there was no opposition at the hearing.
Seeing no questions, I'll entertain a motion.
Favorable.
Have a motion and a second for a favorable on House Bill 26. All those in favor, raise your hand. That is a unanimous report. Next bill.
Next bill is House Bill 172, which is similar to Senate Bill 232, which passed the Senate earlier this session. The bill authorizes a licensed athletic trainer to perform dry needling as a specialized task if the athletic trainer is approved by the Board of Physicians. There are no amendments. The House amendments to the bill that is before you removed the phrase mechanical device from the definition of dry needling, and that phrase was inadvertently left in the Senate bill. So the House will be removing it in order to conform the two bills.
Have a motion and a second for a favorable on House Bill 172. Seeing no questions, all those in favor, raise your hand. Those that are texting, raise your hand. Okay, that bill receives a unanimous favorable report. Next bill.
Next bill is House Bill 234, which is substantially similar to Senate Bill 200, which passed the Senate unanimously earlier this session. The bill authorizes the State Board of Chiropractic Examiners to deny a license to an applicant or take certain actions against a licensee if the applicant or licensee fails to comply with a board order. An order of the board may not be stayed pending judicial review. However, the board may grant a stay of enforcement in accordance with the Administrative Procedures Act. The bill also specifies that the board may appeal any decision that reverses or modifies its orders. And finally, if a license is suspended or revoked, the board may reinstate the license only in accordance with the terms and conditions of the order of suspension or by an order of reinstatement. There are no amendments. There's no fiscal impact. The House will be altering the purpose paragraph of the Senate bill to align the two, so no substantive change.
Have a motion and a second for a favorable on House Bill 234. Seeing no questions, all those in favor, raise your hand. Okay, that bill receives a unanimous favorable report with 11. Okay, gotcha. Next bill.
Next on the list is House Bill 258, which alters the residency requirement for an alcoholic beverages license on behalf of a partnership, corporation or club or limited liability company in Caroline County and a partnership in Queen Anne's County, and makes technical changes. So the bill establishes that the residency requirement for an applicable license is satisfied if at least one of the applicants is a resident of the state at the time of the application is filed, and provides that a license only remains valid for as long as at least one of the applicants is a resident of the state. There are no amendments, there is no fiscal impact, there is no opposition, and the appropriate delegation letters are in the file.
Motion and a second for a favorable on House Bill 258. Seeing no questions, all those in favor, raise your hand. That is an 11-0 unanimous favorable report. Next bill.
House Bill 454 is identical to Senate Bill 187, which passed the Senate earlier this session. The bill prohibits a health occupations board from requiring as a condition for licensure, certification, or registration that an applicant provide proof of lawful presence in the United States, or two, have a social security number or individual tax identification number. The bill authorizes the use of an individual tax identification number or alternate documentation as permitted by the United States Department of Health and Human Services under the Federal Social Security Act for licensing purposes. It does so by specifying that each health occupations board must require each applicant for a license to either disclose the applicant's social security number as required under current law, or individual tax identification number, or provide the alternative documentation as authorized under federal guidance. There are no amendments.
Favorable, second.
Motion and a second for a favorable on House Bill 454. Senator Hershey.
Thank you, Madam Chair. Do we know what the alternative documentation is?
So under current federal guidance, my understanding is that an individual has to provide a sworn affidavit that would include certain information that I don't have enumerated in front of me.
And that sworn affidavit says what? That they are able to apply for this license, or the question became, this bill would enable them to apply for a license, but yet not necessarily work, right? That they doesn't give the ability to actually take on the job. Is that right?
Are you referring to, there was some information that if an individual may be able to apply for the license, but then they would not be otherwise eligible to work in the country, and they would be prohibited from working based on other procedures that the
Correct.
employer has to follow,
Right.
in order to verify that the individual is eligible to work in the country.
Correct. And that's still accurate.
That is still accurate, yes.
And the alternative documentation doesn't change the second part of that, being able to work.
No, it does not, because that process, being able to work, is a separate process from
Okay.
the licensing.
All right, thank you.
Okay, seeing Senator Mounts.
Just to follow up on that, in the hearing testimony, the testimony was, it was that these individuals were, licensing in other states and thereby able to, work in Maryland. Correct?
A subset of the individuals who are being addressed by the bill are individuals who would require an ITIN, an individual tax identification number, in order to work in the state. The problem, as I recall, was presented in testimony, was that an individual who was applying to come to the United States to work as a nurse, perhaps under sponsorship from a member of the Maryland Hospital Association, would not have an ITIN number when they began that application process. And the way that it is currently handled is that those individuals would go to a state like Florida or Texas, where they would be eligible to apply for licensure before eventually transferring to Maryland. Is that
But they still would be prohibited to work in Maryland? Wasn't that the statement that was just made, that they can get the license, but they're not allowed to work?
I think you're referring to Senator Hershey's question?
Correct.
I think he was referring to someone who was in the United States and was undocumented,
I got
and
you.
was therefore not entitled to work in the United States. This bill does not change that person's inability to work.
Okay, thank you.
Senator Reedy.
It does, however, allow someone who's not here legally to get licensed, technically, correct?
I believe that under a certain set of circumstances that could happen, but I'm not an expert and I don't have a hypothetical for you.
Yeah, it's a difficult situation because we understand the intention of the bill to try to let people get a license before they get here, but it is a concern, that one that I thought we had eliminated with the amendments, but I don't think there's any way the amendments can get to that. So, all right, thank you very much.
Okay, seeing no further questions, I would entertain a motion. Have a motion and a second for a favorable on House Bill 454. And let me just ask, this is in the same posture of the cross file that we passed out of the Senate?
Yes, it is.
Same bill.
And which
Okay.
has also passed out of committee in the House, the Senate bill.
Right, and it passed here very, okay, I won't say it out loud. Okay, Have a motion and a second for a favorable. No, understood, understood. No, all things are reasonable. That's why we get 2 bites at an apple. All those in favor of House Bill 454, raise your hand. It's 1, 2, 3, 4, 5, 6, 7, 8. Those opposed, raise your hand. 2.5. No, just kidding. That's 3. So that bill receives a favorable at 8-3. Next bill.
Next bill is House Bill 456, which is identical to Senate Bill 940, which passed the Senate unanimously earlier this session. Bill requires the Board of Pharmacy to adopt regulations necessary to ensure that individuals who are blind, visually impaired, or otherwise print disabled have appropriate access to prescription labels, bag tags, and medical guides at no extra cost and in a fully accessible format and within a time frame comparable to the time frame within which information is provided to an individual who is not visually impaired. The board must give visually impaired individuals an opportunity to provide input on the regulations and requires the regulations to follow certain federal guidelines and recommendations. The regulations must be adopted by January 1, 2025. There are no amendments.
Have a motion and a second for a favorable on House Bill 456. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous report. Next bill.
The next bill is House Bill 615, which extends by 1 year the reporting and termination dates for the work group on Black, Latino, Asian American, Pacific Islander, and other underrepresented behavioral health professions. The work group must submit a report on its findings and recommendations to the Governor and General Assembly by July 1, 2024, and the work group terminates June 30th of 2025. There are no amendments. There is no fiscal impact. There is no opposition at the hearing.
Have a motion and a second for a favorable on House Bill 615. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
The next bill is House Bill 825 as amended and shown in the reprint. House Bill 825 is identical to Senate Bill 506, which passed the Senate unanimously earlier this session. The bill authorizes the town of Forest Heights in Prince George's County to undertake urban renewal projects for blight clearance by exercising the power of eminent domain to acquire properties in blighted areas that are zoned for commercial use only. The town may not initiate an urban renewal project unless its legislative body adopts a resolution that defines the area and finds that rehabilitation is necessary and in the public's interest. And the amendments strike areas zoned for residential purposes from the bill's provisions authorizing the use of the power of eminent domain. That is on page 3 in line 28. The amendment aligns the House bill with the Senate bill.
Have a motion and a second for a favorable on House Bill 825. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
Next bill is House Bill 1159, which expands the qualifications by which a faculty member at the University of Maryland School of Dentistry trained at a foreign dental school may qualify to take an examination offered by the American Board of Dental Examiners Incorporated. Faculty member may qualify if they are a general dentist who, 1, has successfully completed a general dental practice residency or advanced education in general dentistry program, or is board certified by the American Board of General Dentistry. As under current law, to qualify to take the exam, the faculty member must also be a full-time faculty member at the School of Dentistry who has completed at least 7 consecutive years as a full-time faculty member, and 2, must submit to the State Board of Dental Examiners a specified written letter of support from the School of Dentistry. There are no amendments. There's no fiscal impact, no opposition at the hearing.
Okay, there is a motion and a second for a favorable on House Bill 1159. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
So the next two bills are a pair of cross files that ultimately with should the committee vote favorably would emerge aligned. So first, it's easier to explain by addressing Senate Bill 647, which as amended adds a registered pharmacy technician member to the State Board of Pharmacy. Further specifies that a licensed pharmacist may delegate certain data entry to be performed at a remote location to a registered pharmacy technician or registered pharmacy intern. I should note there's a reprint of both of these bills before you. 3, the bill prohibits a registered pharmacy technician or pharmacy technician trainee from making decisions that require professional judgment of a pharmacist. 4, it repeals the prohibition on a registered pharmacy technician administering influenza vaccinations. And 5, prohibits a pharmacy technician trainee from administering vaccinations. The bill also extends the termination date of the Board of Pharmacy by 2 years to July 1, 2025, in line with the other health occupations boards that have been extended by the committee thus far this session. So the amendments to Senate Bill 647 make the bill an emergency bill, specifies that a licensed pharmacist may only delegate the entry of certain data into databases or patient charts to be performed at a remote location and not other delegated pharmacy acts. Specifies that a delegated pharmacy act includes administration of an influenza vaccine only to an individual aged 18 years or older. Authorizes a registered pharmacy technician to administer an influenza, COVID-19, or pneumonia vaccine to an individual over the age of 18, and an RSV or shingles vaccine to an individual over the age of 50, and prohibits a registered pharmacy technician from administering any other vaccine to an individual.
Second.
Okay, you have in front of you the reprint of Senate Bill 647. Seeing no questions, all those in favor with the amendments, raise your hand. That is unanimous.
And then House Bill 693 includes, House Bill 693 is the Senate bill that you just passed as amended, except that the amendment necessary to the House, an amendment is necessary to the House bill in order to effectuate the provisions related to the administration of vaccines. And so the amendment to House Bill 693 authorizes a registered pharmacy technician to administer a COVID-19 or pneumonia vaccine to an individual over 18 and an RSV or shingles vaccine to an individual over the age of 50.
Second.
We have a motion and a second for a favorable on House Bill 693. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report with the amendments. That is it for today. Thank you very much to the staff and to the members for making it on time to get through this. Just by way of scheduling, we actually have a hearing tomorrow on a bill that came to us, an emergency bill. So we'll have a hearing in between the sessions tomorrow, assuming there's a second session. We may have some additional bills available for voting that they're working on now, but we'll keep you posted on that. And yeah, so we'll just plan to come here after session tomorrow for the bill hearing on the bill related to Charlotte Hall. And then take up any voting that we have available. Thank you very much. Meeting adjourned.